Good afternoon, everyone. Thank you so much for joining us today at our Nurse Wellness is Public Protection webinar. My name is Jana Bitten. I'm with the Oregon Center for Nursing, and I am so excited to be able to facilitate today's conversation. This webinar that we're having today is the brainchild of Rachel Prusak from who's the Executive Director of the Oregon State Board of Nursing, and it's also being offered in partnership with the Oregon State Board of Nursing, the Nurses Association, the Oregon Nurses Association, and the Oregon Center for Nursing. As we've been talking about this for over the past 4 years, we know that the statistics about the mental and emotional health of nurses, those statistics have been sobering. Since the summer of 2020, OSBN has been addressing the toll the pandemic has taken on nurses' mental health, not just in Oregon, but across the world. Reports of stress, overwhelm, and anxiety have poured in, along with descriptions of various coping strategies, both healthy and unhealthy. OCN has a program called the Oregon RN Wellbeing Project, and that focuses on the occupational hazard of stress in healthcare settings and how organizations can implement meaningful changes to protect their nurses' mental health. Our work is really focused on the prevention of that mental harm, but we still need to make sure that there's a solid response to the mental harm once it occurs. And that's what this webinar is here and what it's designed to do. So the next hour is devoted to you and focusing on you. I really appreciate and I'm thankful that you are here today and you dedicated an hour of your day just to focus on yourself and this vital profession. Whether you're here to learn about how to teach this material to others, because you have to manage nurses and you see the stress that they endure, because you yourself have felt overwhelming stress, or because you're seeking help with potentially unhealthy coping mechanisms, we're really glad you're here. Every nurse in Oregon is a valuable resource, and we understand where you're coming from. We want to help you if we can. So today, as part of this webinar, you're going to hear from a variety of experts who can offer some ideas about how to help others or even how to help yourself. And if you have any questions, go down to the Q&A panel and you can ask your questions there. We're hoping that by the end of the hour, we might have some time for questions. And we've got a really packed agenda with a lot of people here. And even if you don't have a chance, even if we don't have a chance to answer those questions, we're hoping to put that, compile all those questions together in a resource that we'd be able to share with you afterwards. So, and we also have many other resources that OSBN has put together on their website. We're going to be able to share that with you as part of today's webinar as well. So we're going to start by turning it over first to Clarissa Carson from the Oregon Wellness Program. Clarissa is a board-certified psychiatric mental health nurse practitioner with a comprehensive background in nursing and psychology. Clarissa's dedication to excellence is evidenced by her recognition as an executive committee member of the Oregon Wellness Program, specializing in mood disorders, trauma and PTSD, substance use disorders, peripartum care, LGBTQIA+, and adolescent care. Clarissa brings a wealth of knowledge and compassion to her practice. Clarissa, let's take it away.
Thank you, Jana, and thank you to Director Prusak and the OSBN for allowing me to join today's session on nurse wellness as public protection. Today, I would like to discuss the invaluable support the Oregon Wellness Program offers to healthcare professionals and offered to me during the difficult days of the pandemic, where I worked as an ICU nurse at Asante Rogue Regional Medical Center here in Medford, a national COVID hotspot in August of 2021. I hope that some of my experiences will resonate with all of you, as so many of us were nurses through this historical time and still carry the memories with us every day. When I walked, when I walked into work each day in August of 2021, the hospital felt more like a war zone than a place of healing. Our hospital was overwhelmed, resources were stretched thin, and every day brought new challenges. As healthcare providers, we were not just fighting a virus, but also managing the fear and uncertainty that came with it. During this period, the emotional and physical demands were immense. I remember vividly the anxiety and helplessness felt by patients and staff alike. There were moments when patients, terrified and alone, would plead with me not to let them die. Coming back coming back for another shift, and finding that those patients had passed away was heartbreakingly common. Navigating through crowds of protesters who didn't believe in the severity of what we were facing added another layer of stress to our already heavy burdens. The experiences that I have had, and many of you have also experienced, highlight the profound impact such crises have on our mental health. Feelings of burnout, helplessness, fear, and moral distress were not uncommon. My complimentary OWP sessions helped me process this unprecedented event in a way that allowed me to understand them more fully, put down some of the heaviness that I had been carrying during the pandemic, and continue to show up in my job each day for my patients and coworkers. We don't need to look very hard to see that our healthcare professionals are still in crisis. Existing structural issues for nurses and doctors, such as workforce shortages, high turnover, heavy workloads, employee workplace trauma, safety concerns, and employee burnout, were only exacerbated during the pandemic. This was especially felt in the nursing profession, where, according to a National Council of State Boards of Nursing survey, between the start of the pandemic and 2027, nearly 900,000 registered nurses will leave their jobs. The mission of the OWP is to promote wellness for healthcare professionals in Oregon through coordinated counseling services, education, and research. The vision of the OWP includes by and for healthcare professionals, confidential and voluntary, complementary, timely and flexible to help address the burnout epidemic, funding that follows the client regardless of healthcare entity affiliation, and reducing barriers statewide. The Oregon Wellness Program is truly a one-of-a-kind endeavor, envisioning support well beyond and independent of a traditional work-based employee assistance program. The OWP is structured to address many of the unique barriers that healthcare professionals face when they consider seeking professional mental health services. Unconstrained by their institutional affiliations or lack thereof, the OWP offers healthcare professionals licensed by the Oregon Board of Medicine, Board of Dentistry, and Board of Nursing, including RNs, CNAs, LPNs, and advanced practice RNs, the one-time benefit of up to 3 one-hour, time-sensitive, and confidential mental health counseling sessions with a highly skilled OWP mental health professional. The 34-person OWP mental health professional team provides a network that serves all the geographic areas of Oregon through in-person or telehealth appointments. Each OWP provider has been selected for their expertise and experience working with healthcare professionals and familiarity with healthcare environments. If clients are interested in continuing on with their mental health professional after those 3 sessions, the provider will work with them on paying out of pocket or through insurance. No referral is required. Simply visit OregonWellnessProgram.org, pick a mental health provider, and call them directly to schedule your first session. When nurses were asked if they are interested in receiving mental health care, 78% of respondents said probably or definitely yes. So in addition to providing real-time, crucial mental health services, the Oregon Wellness Program is conducting a prospective longitudinal study through the OHSU School of Nursing to assess its impact on the professional quality of life of Oregon healthcare professionals, as well as better understanding of the mental health challenges facing Oregon healthcare workers. The Oregon State Board of Nursing began its journey with the OWP to provide mental health counseling services for Oregon's nurses in June of 2022. Since then, 637 nurses have received 3,230 hours of counseling. The numbers of nurses accessing the program has grown as awareness of its availability has expanded. The OWP team believes that as nurses gain confidence that the OWP will continue to be available to them, and as word of mouth grows, the numbers of clients and associated counseling sessions will escalate. This is a win-win for both the OSBN and Oregon nurses. Access to OWP services signifies to nurses who are overworked, understaffed, and possibly on the cusp of addiction challenges that they are seen and help is available. The OWP is meeting a need, and Oregon's healthcare professionals are responding. I strongly encourage everyone here today and all those watching to engage with Oregon Wellness Program, whether you are facing the stressors of a global pandemic or the everyday challenges of healthcare. The OWP is here to support you. Learn more at OregonWellnessProgram.org. Thank you.
Thank you very much, Clarissa. We really appreciate that perspective. And again, we're going to be having all of the resources. We'll make sure we are sharing with all of you. So thank you again. Next, I'd like to introduce two special speakers that are not from Oregon, but have a perspective that I think is incredibly important to the conversation that we're going to be having today. First, I'd like to introduce Kristen Waite-Labatt. Kristen has been a registered nurse since 1991. After losing much to alcohol and opioid use disorder, she found recovery in 2005 and now works as a senior admissions coordinator with the Freedom Institute, a treatment program for those with substance use and mental health issues. She founded and serves as the president of OSBN, which is the Wisconsin Peer Alliance for Nurses, something that we really need in Oregon, which is a nonprofit organization providing peer support for nurses with substance use issues. She's a certified addictions registered nurse and a certified professional recovery coach. And then after Kristen gives her presentation, we're going to hear from Dr. April Lensmeyer. Dr. Lensmeyer is a nurse leader and consultant with more than 20 years of health system provider-related industry experience. In her current work as a nurse consultant, April helps health system and provider clients with providing organizational and cultural assessments, using design thinking to support systems and enhance change management, providing high-quality outcomes in health systems across the nation. Kristen, we'll hear first from you, and then Dr. Lensmeyer will hear from you. Thank you very much.
Thank you. Thank you for inviting me here today to speak. I'm so grateful to be able to share a little bit of my story with you. So as Jana said, I've been a nurse since 1991, which seems crazy to me. There was never anything else I wanted to do besides nursing since I was little. But in 2004, I lost almost everything when I was discovered diverting fentanyl from the hospital I was working for. It started with alcohol in college and then some prescription pills after a surgical procedure in 1997. Life was stressful and those pills made it better, at least for a little while. In the years following, I found reasons to get more pills. And then one day I was working in the emergency department and I, without much thought, took what I had left over after a case instead of wasting it. And really from that point on, I took almost every leftover controlled substance I had, didn't matter what it was, instead of wasting it. Figure about over a 3-year period of time. My use escalated around 2003 after a divorce, and the first time I had leftover fentanyl and took that instead of wasting it. From that point on, I really was not able to stop. I eventually started stealing fentanyl from stock, and it doesn't take them too long to figure out what's going on when you're doing that. So in 2004, I was fired. I lost my nursing license, and I ended up spending about 4 months incarcerated after a reoffense. Once released from jail, I really threw myself into building a recovery community. And when I say threw myself, I literally threw myself into those meetings. I never wanted to return to substance use. Jail was awful. I did not like it, and I don't ever want to go back there. I vowed to continue to develop those skills that I needed to stay in recovery, and I've gratefully done that since January 17th of 2005 with no return to substance use. I was, and I am, an excellent nurse. I excelled in my practice. I was looked at as a role model by my peers. I had perfect yearly evaluations, but it still happened to me. And I'm certainly not the only nurse that this happens to. The American Nurses Association says that 10 to 15% of nurses struggle with some form of substance use disorder, and that 6 to 8% of them are working impaired, working under the influence of alcohol or drugs enough to impair their practice. Substance use disorder does not discriminate. It can happen to anyone. It can happen to any nurse. When I was diverting, I wanted so badly to stop, but I couldn't. I didn't know there was a program here in Wisconsin called the Professional Assistance Procedure that I could join. I could keep my license. They would help me find treatment, and they would make sure that I practice safely. It's a confidential program, but I had no idea it existed. Many states have similar programs, 43 of the 50 states, I believe. But even today, not many nurses know they exist. So once I was in recovery for a couple of years, and with encouragement from my therapist, I decided to try and get my license back. And so I applied to and was accepted into that alternative to discipline program, that professional assistance procedure here in Wisconsin. It was hard, and I wondered if I'd be able to make it through. I knew the rules, I was able to follow the rules, but there was no support at the time, no one to talk to or guide me through it. Many nurses quit the program. It's expensive and they couldn't afford it. There's so many restrictions and limitations. It was really hard to find work with that, with a restricted license. And so many nurses just gave up. Finding a job is really hard when you have limitations, like I said. I was so grateful to be a nurse again, but I was really afraid that I was going to mess something up and lose everything again. The fear was just unbearable sometimes. I didn't know if I'd be able to finish having to work full time and take care of 2 daughters on my own after my divorce. I also didn't know there were about 300 other nurses going through the same thing, very similar circumstances in that program. We had no way to connect with each other or support each other. I did complete that program, and I have my full licensure back today, which is awesome. And again, I'm so grateful for that, but it was harder than it needed to be. So fast forward to 2020, COVID is in full swing, and I was introduced to peer support programs in other states. So the SPAN program, or Statewide Peer Assistance for Nurses in New York, and the NPSN, the Nurses Peer Support Network in Minnesota. These programs offer peer support to nurses that are in early recovery, going through monitoring programs, and beyond. And I was so excited when I learned of these programs. And so I thought, we need that in Wisconsin. And Wisconsin Peer Alliance for Nurses was born. The mission of WSBN, for short, is to be the leader in peer support for nurses in Wisconsin. We offer peer support meetings for nurses with substance use issues and/or those who are going through a monitoring program, but they don't have to be. We also offer peer support for nurse mental wellness, which we just launched in January of this year. Understanding that substance use often starts with some form of mental unwellness, stress, burnout, that kind of thing. We thought, wouldn't it be great if we could provide peer support to nurses before their stressors got to the level that they were using substances to cope? Wouldn't it be great if we could intervene for nurses and get them the support they need early? That's our goal. All of our meetings are run by Wisconsin nurses, but don't hold that against us. All of them are virtual, so any nurse can join. In fact, we had a nurse from Australia join in a few weeks ago. They're all led by nurses experiencing the same or similar issues as to the meeting they're facilitating. So if they're substance use meetings, they're nurses in recovery. If they're the nurse mental wellness meetings, they're nurses who have been through some form of mental issue that they have overcome. So it would have been so helpful for me back in the day, in those early days, to have someone to talk to about what I was going through, someone who was going through or had been through that monitoring program, just to talk with them and help me know what to expect. I didn't have that, but today nurses do, and it's crucial. What are some other really important words? That nurses and people who are leading nurses, whether it be nursing leaders, human resources, employee assistance programs, and the like, It's crucial that they know the resources that are available to nurses in their state. So important. So thank you. That's a very brief synopsis of my story. If you'd like more information or if you'd like to talk, you can email me at wispan2021@gmail.com. That's WISPAN2021@gmail.com. Thank you so much. And I should say, Dr. April, you're up.
Feel free to call me April, but thank you. When you work so hard to get a DNP and you have to turn in a formal bio, you throw it in there because it feels good and I'm proud of it. Thank you for having me. Kristen, oh my gosh, your story is same as mine in some ways, but very different from mine in other ways. So it's absolutely perfect that we both are here sharing our story. Thank you for allowing me to do so. It's a privilege. It's hard. My little heart is pounding anytime I talk about myself and my journey through my substance use disorder. I get a little shaky, so be patient with me, but it's a privilege to talk about it. It's a privilege to be here to share my journey to peer support today. My story is at a high level, but what I'm hoping you get from it is the message about my journey through pain and suffering to hope and recovery through peer support, specific peer support. All the things that Kristen was talking about is the reason I'm here today, and I'm going to share all of that. But I want you to come away with that message that no matter what, even if there's a fear that there aren't resources or there isn't hope or there's no one or nothing that can help a nurse who is struggling with a substance use disorder, there really is. So here we go. My story is a journey that is through nursing and recovery together. I say that they're overlapped because both of them found me. I didn't necessarily choose them. Like Kristen, I have always wanted to be a nurse. I have been a nurse for over 21 years. It's the only thing that I was going to do with my life. I surrendered to it and I dedicated my life to it. I didn't even see it as work. I saw it as something that I was just literally called to do. And I did it. I loved caring for others. I wanted to make a difference in other people's lives, which is so similar to what I'm doing now in recovery. I had so much empathy for others, and I wanted to see them well again, similar to the empathy I have for nurses that are suffering and how much I want them to be well again. I took my first drink at such a young age. I was 12 years old. I drank a lot of it. I instantly became very intoxicated and very sick for several days after that. Most normal people would probably say, you know, we're not going to do that again, but not me. I was unaware that I had a problem with alcohol at the age of 12, but I knew that I wanted to drink more of it. And it was the beginning of a 28-year-long problem drinking career for me with an alcohol use disorder. I drank heavily throughout my high school years and into college and into nursing school. I was always the first one to suggest a drink in my nursing students and colleagues and my colleagues at work and my friends. And I was always the last one to leave the party. I made it. I made it through all my schooling and I made it through boards. I maintained a critical care position in the ICU for many years while I had my babies and I raised a family. Some call it a functioning alcoholic who can do that, but really, I was suffering. I remember some days at home and at work, I was so sick I couldn't perform. I would have to call in sick a lot. Most of the time, I kept it under the ill-time radar so that HR wasn't knocking on my door. Some days I just had to fight through it because I knew I couldn't call in sick again to keep my job. Pretty soon, and as it all evolved, and being an ICU nurse, trying to deal with the traumas in the ICU and my family at home, and all my illness, my hangovers were so severe, I just started to drink the next day after. I thought, I'm not going to be hungover today. I'm going to drink today. And that started to really change things for me when I started drinking to feel better the next day. By grace, I did not experience licensure problems. I did not experience performance problems. In fact, I grew and I was able to be still a part of those extracurricular things in the job and at work. Interestingly, I think that there was a path for me that I wasn't even really aware of that I was actually on. But I didn't get in trouble, the kind of trouble that Kristen talked about and other nurses get into. That's why my story is a little bit more unique, but it was affecting my work. It was affecting my relationships with patients, families, and my own family at home, and especially myself and my young children. I was irritable, angry, disengaged. Looking back now, I know how self-centered that was, but I was sick. I didn't even know how sick I actually was. Going out, getting drunk was common among not only my family, but with friends and colleagues at work. It was super common for us in the ICU to go party after the night shift for breakfast, quote unquote. It was really commonplace and people didn't think anything of it and we would laugh about it. It was funny. I didn't know that 1 out of 10 of us, like the general public, was at risk of having a problem with alcohol or substances. I'm also a result of the mommy wine club culture. I drank a lot of wine because that was accepted while I was raising my young girls. Drinking was unmanageable for me. It affected my health. It ruined my relationships. I had no idea what resources were available to me. I never even thought about reaching out at work. Are you kidding me? I would never even mention that I had a problem at work. And there was nothing that was available to me, posted to me. Nothing was ever mentioned that there were even resources. So I suffered silently and alone, full of shame and guilt, extreme physical withdrawal symptoms and sickness on a daily basis for years. I knew that I was running out of time before I was going to be in trouble at work, in trouble with the law, or something even worse. I could hurt my patients. I could have hurt my children. I was at a leadership convention. Fast forward just a little bit. I'm a nurse manager now of the ICU. And I was at this convention for leaders and I heard the founder of the Minnesota Nursing Peer Support Network speaking about leadership. But she also was using some language that was related to misusing substances. And I caught it. I heard it. It caught my attention. I was like, who is this lady? Why is she dropping these little pebbles of recovery and substance abuse in her talk? Well, that was her thing. That's what she did. Anytime she spoke to a group of nurses, she always made sure to put the pebbles there, she said. I looked her up. I found out that her name was Marie Manthe, that she was the founder, like I said, of the Minnesota Nursing Peer Support Network. But more importantly, she was a nurse like me. She was a leader like me, and she was an addict. She presented herself to the world as an alcoholic in recovery. And I was shocked that she was that person, that it wasn't just me that was suffering, that there were other nurse leaders that had suffered like me, and that they were talking about recovery. How could this be possible? She taught me that it was possible through nursing peer support. She knew I was in trouble. I told her that I needed help. She took me under her wing. She got me set up with resources and meetings immediately. I, for the first time, felt safe, protected, and loved as a nurse, from one nurse to another. Marie taught me that it's going to take another nurse to help me change my perspective, to cut through my shame and stigma. And boy, was she right. I was in AA meetings that it wasn't clicking and it wasn't working. But as soon as a nurse came to me and helped me, that's when I was able to change. Peer support through the Minnesota Nursing Peer Support Program taught me that I am not my behavior, that I am sick, that I was not morally failing. I was an addict. And like nursing, recovery found me and I surrendered to it. And I turned my will and my life over to the peer support program. And what if those resources weren't available to me? I don't know what would have even happened because they weren't available. Nothing was offered and no one was talking about what they were doing for helper resources in the workplace back then. And I have not used alcohol in 8 years this December. I am a living example of the amends that I make through my actions and behaviors for the patients and families that I serve now and the clients that I serve now and my children. They're still learning how to forgive me and understand me, but they can finally trust me again, and they know that I'm in a strong program. They know that people can change and that recovery is possible, and so do the nurses that I sponsor and support through peer support. I give back through my membership and involvement through the Minnesota Nursing Peer Support Network, but I'm also engaged in speaking events. I'm also convening and sponsoring in a global community called In the Rooms every Tuesday at 7 p.m. Central Time. And it's, like I said, it's a global recovery network site. So any nurse is welcome. And any nurse is welcome to reach out to me if there are problems with substance use disorders, or if they're just looking for information. I dedicated my project at school to support resources and get them on the wellness pages of healthcare organizations where nurses work. I'm hoping to reach any nurse throughout our country, but I'm done with my story. Thank you for listening, and I'll hand it back over to you, Rachel. Or Jana.
Or Jana. April and Kristen, thank you so much for sharing your stories. This was really powerful, and thank you. It really spoke to me, and I hope that also spoke to other people too. Thank you for being here. Thank you for sharing your story, and thank you. Now we're going to move over to the Oregon Nurses Association. We're going to talk with Christy Simila. And by the way, nobody's asked any questions, and you don't have to, but if you are interested in asking a question, if you want to share something, go down into the Q&A at the bottom of the screen, and you can put your questions in there. That'll be sent to all the panelists, and we'll be able to answer it at the end if we need to. April, if you're okay with it, I'm also going to put your email address into the chat. Is that okay?
Please do. lensmeyerapril@gmail.com.
Okay, I will put the email in the chat if any of you are interested in reaching out to April. I'm also going to put into the chat the link for the In the Rooms Global Recovery community, and also the Peer Support Network for Minnesota, just so you can take a look at it. So
Perfect.
While those things are getting into the chat, let's bring up Christy Simla from the Oregon Nurses Association. She's the Director of Professional Practice at ONA. She's a registered nurse with experience in acute care, nursing continuing professional development, and nursing practice consultation. Her passion for nursing and leadership have made her a strong advocate for her patients and for her profession. As a certified holistic nurse and health and wellness nurse coach, Christy advocates for her patients and colleagues to explore their own well-being and supports them in pursuing wellness that is aligned with their needs. Christy, take it away.
Hi, everyone. Thanks for having me here today. I'm really here to talk a little bit about the work we do through the Oregon Nurses Foundation with a resource called the Nurse Assistance Network. And through the Nurse Assistance Network, we provide a response line that nurses who are struggling with substance use can call to talk to someone about their options for seeking help, self-reporting, and successfully returning to work after recovery. When someone calls this response line, they're connected directly with a nurse who can help to answer questions and talk through the self-reporting process, what to expect, and what other resources might be available for them. Through the Nurse Assistance Network response line, we hear from many nurses that they are hesitant to reach out for help around substance use and mental wellness because of shame, guilt, and fear of discrimination and stigma. Many are also afraid that reaching out for help could destroy their career as nurses. We often hear from nurses when there's already a pending investigation in the workplace involving impaired practice, and the employer is encouraging them to self-report to the Board of Nursing. The nurse is curious about the self-reporting process and is seeking guidance, but is really hesitant or fearful about calling the board to ask these questions directly. So we are able to offer some guidance and support around what that process looks like. We also hear from nurses that are seeking resources to get help for substance use or mental health issues before they directly impair their practice. And they're just curious about what resources are available to them. This is really the ideal time to reach out for help before it becomes an issue at work. It can be really scary and tough to talk to someone about, but acknowledging something's going on, pausing to seek help early on, and taking care of your own well-being will get you back to work and practicing safely in the quickest way possible. It's so important to seek help early on without shame or fear, knowing that there is help and treatment available. And if you need help, please reach out to us at the Oregon Nurses Foundation. You can find information on the Nurse Assistance Network there. Thank you.
Thank you so much, Christy. And I've got the link to that is also in the chat. Please don't panic if there's a whole bunch of links in the chat and you just aren't sure you're going to be able to keep track of all of these. We'll make sure that this is a resource that's provided to you later. Thank you. And next up, we're going to hear from Victoria Priola, who is a licensed clinical psychologist, educator, and consultant, and has been for the last 20 years. Her primary professional focus has been applying psychological theory and practice to the fields of education, law enforcement, and healthcare. Her primary goal has been to help individuals, groups, and organizations utilize psychological concepts to help them function effectively and safely within these increasingly complex and demanding fields. She also works directly with licensing boards to assist them in their understanding of the relationship between wellness and public safety. So Victoria, let's turn the time over to you.
Thank you so much. I can't really find the words to express how excited and happy I am to be here to talk about this topic. And I think the most important part of who I am and what I do that I didn't include in my bio, and I think I will from now on, which is I'm the daughter of a nurse and I'm the mother of a nurse. And so a lot of the issues that all of you are talking about, and certainly the work that I do every day to support and advocate for nurses, really is very personal to me. So as a clinical psychologist, I think as I sit here and listen to what everyone's talking about and reflect on the work that I did just this morning in some of the groups that I run for nurses and doctors specifically, I think one of the things that stands out for me is that it can happen to anyone and that access to care is much harder than it needs to be. And I think that those 2 points are really crucial as we sit here together and think about how to move this access piece of mental health and substance abuse care to nurses. How do we move that forward? And I think it's really important for us to all acknowledge that if we don't support nurses, we as people in healthcare and the general public, if we don't support nurses with easy access to resources and tools to take care of themselves, the fact of the matter is that their ability to provide high quality care will be increasingly at risk. And what exactly does that mean? From a psychological perspective, what that means is that we know from the literature and from the clinical practice that mental health and general well-being are connected through professional decision making. And what I mean by that is that if you're not feeling well, you can't think clearly. And obviously, we can all appreciate the problem with that when you're charged with taking care of 1, 2, 3, 4, 5, 6, 15 people during your shift. So nurses with untreated and unmanaged stress are at risk for medical mistakes. And they're more susceptible to the moral injury that comes along with that. That's problematic because, well, for obvious reasons, but most importantly, some nurses tend to think that they're protected, and healthcare workers in general think they're protected because they're clinically skilled or because they have a lot of experience on the job. Neither one of those things protect anyone. Everybody's brain works the same way when they're stressed. It's compromised. And so when we think about what we need to do about that, the most obvious thing is to destigmatize access to mental health. We also need to acknowledge that there are a tremendous amount of systemic issues that are at play and why nurses need access to mental health care. It's tough out there. We all know that. We also have to acknowledge that having a difficult time coping and managing and doing our jobs effectively, that's a normal reaction to stress. And therefore, we need to normalize access to support to find the tools and resources we need to go back and do the kind of job that we know we're capable of doing and that the public expects of us. So it's really important for us to appreciate that skill and experience are not protective factors here. And I think it's also important for us to be talking about all of these things today in terms of let's all talk about how normal it is to need care. It's a professional and a personal ethical obligation. And I can't stress that piece enough. We need to get behind nurses in every way that we can dream up. We need to get super creative, and we need to stop contributing to this idea that mental health issues are some kind of personal or characterological flaw. It's part of the job, unfortunately, the way that things have sort of escalated since COVID, even though we all know that being a nurse was difficult even before COVID came on the scene. So what we're going to do, I hope, as a result of conversations like this one, and hopefully others that you'll all have after this webinar with colleagues, family members, friends, is to talk about how we can create easy access to high quality mental health care and create effective strategies for protecting nurses, their health and well-being. Because if they're safe and they're well, the public will be safe and the public will be well. Thanks for this opportunity. Please reach out to me. My email is vjpriola@yahoo.com. Thank you.
Thank you so much, Victoria. I really appreciated the concept of that these stress reactions are normal reactions and therefore they need a normal response. I actually wrote that down because I want to make sure that people know that like that skill and experience are not protective factors. That was really excellent. So thank you so much for sharing that. I'm going to make sure that your email address does get included into the chat, and that will be another resource. And if you'd like to reach out to Victoria after this, she's available. Thank you so much. And now the final speaker that we have today, and again, you haven't asked any questions, so if we end this a little bit early, well, you'll just turn it back over to me and you don't know what's going to happen then. But we're going to turn it over to Director Rachel Prusak, who became the Executive Director of the Oregon State Board of Nursing last July, following a national search with broad participation by agency staff and stakeholders. She is a board-certified family nurse practitioner who works on the front lines of healthcare, dedicating herself to vulnerable communities for over the past 2 decades. Her leadership during the COVID-19 pandemic was instrumental in ensuring the safety and well-being of the public. She served as a nurse on the front lines and also the chair of the Oregon House Healthcare Committee in the legislature during that time. We are so fortunate that she has left the legislature and come into this particular role at this particular pivotal time in nursing workforce. And I'm really excited to turn the time over to her. Director Prusak.
Thank you so much, Jana. And Victoria, I love that your dog just came into the picture, because I think all of us also know how much our pets and animals contribute to our mental health and our wellness. So thank you for that. So I want to just thank all of you first for sharing your personal stories and being so brave, because I think as you shared, someone did that for you to help you. And I hope that that is what's going to happen today. I was at a National Council State Board of Nursing conference where I met Victoria, who was presenting on what shouldn't be a radical idea, that nurse wellness is public protection. It should not be a radical idea. Because nurse wellness is public protection. And I think if nobody asks questions, we'll make Victoria say that statement once more, Jana, with her camera on. So we close with that statement that stood out to you. So for my portion of this, I really just wanted to take a second to demystify the board for anybody that might be watching once it's shared out what the board is. So the Oregon State Board of Nursing was established in 1911, and the governor appoints the members. There's 9 members on the Oregon State Board of Nursing. They include 2 public members, 4 registered nurses, 1 licensed practical nurse, 1 certified nursing assistant, 1 nurse practitioner, and the 4 nurse members represent various areas of nursing practice: nurse educator, nurse administrator, and 2 direct care non-supervisory nurses. And they also represent a variety of geographic locations, ensuring the unique needs and challenges of the different regions of the state are considered. And they represent facility type variety, and also diversity for racial diversity. And I want to share that since thinking about how nurse wellness is public protection, the leadership of the Oregon State Board of Nursing came together and took a look at their mission. And it is actually going to be submitted today is the deadline for our strategic plan. But it is that the Oregon State Board of Nursing is committed to protecting the public through regulatory excellence and promoting the wellness of nursing professionals, because we believe nurse wellness is public protection. And we added a vision, and that's that a healthy Oregon is promoted through a diverse nursing workforce. So I just want to also touch upon the history of alternative discipline programs in the country. When I started thinking about nurse wellness as public protection, I went to a conference and a board member and a nurse investigator joined me to the National Organization of, NOPE. We're being recorded and I can't remember it. It's all about alternative discipline. And since the 1980s, states have passed legislation to offer treatment to nurses facing addiction without hurting their licenses, as long as they continue to meet specific requirements. Florida was the first state, and really nurse leaders and others were a part of ensuring this got off the ground and running, which is now NOPE, N-O-A-P. But each state is given the power to regulate professionals such as nurses within its jurisdiction, to let boards of nursing use their professional expertise to enact rules or regulations and to implement and enforce the statutes relative to the practice of nursing in its state. And when the alternative discipline approach is used, the most crucial benefit to the nurse and the public is that it enhances patient safety through early intervention and quick entry into monitoring. Nurses can continue to provide nursing care, which is especially important as the demand for nurses are high, and you continue to get paid and remain active in nursing while being monitored. So while Oregon is not actively participating in alternative discipline program since September of 2022, the board is currently discussing on steps to re-engage because they know the decade that the Oregon State Board of Nursing was connected to a program. Approximately 600 nurses were supported in the recovery from substance use disorder, remaining in the workforce while being monitored, and many returning to wellness. The other stuff the board is engaged in right now is looking at collaborating with the Lorna Breen Foundation. They presented to the board, and we have started the process to really remove the stigmatizing questions about mental health from applications. A lot of the medical boards have done this across the country, and nursing boards are starting to do it too. So it really is steps to show the commitment that the Oregon State Board of Nursing believes nurse wellness is public protection, and that starts with engaging and removing the stigma. So the other things that I'm hoping this webinar does is really show you all the resources. This first webinar is, what are the resources out there? You can reach out to Oregon Wellness Program. You can contact NAN. You can reach out and join the peer-to-peer support groups and all the other states that are offering them. And we have 2 examples here. And the Oregon State Board of Nursing members requested that our website include mental health resources. So those are live on our webpage as of today. And as everybody here mentioned, I think it's so important for nurses to know how important it is to care for themselves and care for each other. And with this being the first webinar, we already know that the second one really needs to focus on hearing from nurses of color and how our work is impacting their mental wellness. So I think that I have shared everything that I need to. I know that there's some time left if questions did come up, but I think Victoria, and actually I need to look up what NOPE stands for because I can't believe I'm having a brain freeze. So Victoria, while I do that, please say the statement, or Jana, repeat the statement that she shared and cover me while I do this. Alternative programs.
Well, yes.
National Organization of Alternative Programs. Thank you.
So the National Organization of Alternative Programs.
Yes.
So it's NOP or NOPE?
Whatever you want.
I don't know. Anyway, thank you. Thank you.
I like saying nope, but it's also, nope.
It's
just
it's an easy way to remember it.
yeah,
Thank you.
yeah.
Thank you.
But don't have that, have the recover my blip with the beautiful sentiment that was said.
We will, yeah. We'll edit that, or we won't. And then that's going to be something super fun for people to find. All right. Thank you. Thank you, Rachel. Thank you, everybody. Thank you, everybody, for being here. I put the link to the OSBN webpage about the nurses' wellness that is live now. Please pay attention to the very top of that page where there is a PDF that you can download with some mental health resources if that's something that you need to have, or not just necessarily for maybe it is for yourself, but also we need to change the stigma and we need to start a movement when we're talking about mental health and well-being of nurses in the state of Oregon. Take a look at the resources that are there to be able to support all of the nurses in our entire workforce from the harm that they may have experienced just from the inherent occupational hazard of being in the workforce. We know this is what we've learned today over the last 50 minutes is we know that nurses are human beings that have very normal responses to stress and overwhelm and frustration. We know that those constant exposure to those responses can cause some pretty serious damages, which could be physical, or they could be a mental and emotional, and they could even go to the point of substance use disorder. Skill and experience are not protective factors for any of that because we've all had experience being human beings and we're all very skilled at being human beings. And guess what? Stress and overwhelm and frustration and all of those burnout symptoms that we've been talking about, that happens to everybody. It just can happen in the healthcare profession a lot more, and especially now that we are after the COVID-19 pandemic, now we are starting to realize exactly what that stress can actually do to you. So let's change things. Let's change things in the state of Oregon. Let's change things across the United States. Let's make sure that you know that you have 8 people that are all here, that we all have ideas of where resources are. Some of us have all of those things that are printed out, and some of us have had direct personal experience. Please do not hesitate to reach out to anybody on this call if you need help for yourself or somebody that you know. And beyond that, do not worry if you are in this situation. Don't feel like you are going to get found out or there's something you need to be worried about. There are things that are in place to make sure that you can be protected and the public can be protected, and we just all need to work together so that all can come together in the beautiful tapestry that is the nursing workforce. No one has asked any questions, which is just perfectly fine. This is going to be recorded. So we are going to have a link to this probably no later than tomorrow. So be looking for it at least by tomorrow. It probably won't be by the end of the day today, but by tomorrow. And if you are watching this in a recording, don't think that any of these resources are not available to you. You don't have to be here live in order to be able to access any of these resources. They're available. So we will make sure that there is a link to all of that and you can access it. And thank you so much for coming. We really appreciate
Jenna,
it.
can I ask everybody, since we have time, if they have any burning things they didn't say and are thinking about that they wish they said?
If you do have any burning, you mean all the panelists?
Yeah.
Okay, panelists, is there anyone here who, after you've heard everything, you're like, oh, I wish I'd said that? This is your chance.
I just like to remind everyone that a well nurse is a safe nurse.
Perfect.
Mic drop. I don't know if we need anything else.
Can I add something?
Absolutely.
Not that we
Kristen.
need it after that, Victoria, but I just really want to encourage us all to talk to each other about our struggles and about what we're going through. I spent so many years keeping it all inside and trying to pretend like I had everything all together and life was great when it wasn't.
Yeah.
We don't need to pretend like things are good when they're not. Life is hard. Life can be awesome. I don't want to poo-poo life, but life is wonderful. But there are days that are hard, and we just need to share that with each other and talk to each other about how we get through it. And don't bury it. Talk about it. A problem, shared decreases by 50% or so.
I love that. Thank you. All right. With that, I think we'll go ahead and wrap up so we can get this posted and you can see this. There will be more conversations just like this. And there will be more webinars and more discussion, because this is not something that we can just put one webinar out and we're like, we have solved the problem. No, this is going to be a constant conversation, and I am here for it. And I'm excited to be partnering with all of these wonderful women to be working on this. So thank you everyone for being here. And if you are interested in joining this conversation, or if you have any recommendations or any thoughts of ways that we can improve in the future, you can send me an email and I'll put that email in the chat really quickly. And we can hear from all of you about what we can discuss in the future. All right, and with that, there's my email address. You can copy that down really quick. And with that, I think we'll go ahead and close. Thank you so much for being here. Thank you for spending your lunch hour with us. And we look forward to talking to you next time. Take care.